Let's start with we actually start educating our staff. I mean, for the entire enterprise, we start talking about value-based healthcare over the past 2 years. And before we really start the ICHOM set implementation, we actually start looking at how to develop clinical excellence in business, and value-based healthcare is part of the topic that we discuss about. And then later on, we start using ICHOM set to integrate it into our care pathway, care process. And in the past, we just collecting customer satisfaction and clinical outcome, but we had never integrated patient report outcome into our indicator. So over the past 2 years, we really deeply dive into using patient report outcome and also ICHOM set, and also using the principle of value-based healthcare to shape our clinical practice and also monitoring of the process and outcome in daily operation. As I mentioned earlier, before we start doing the value-based healthcare, we actually developed the program called Center of Excellence. So we had implement concept of Center of Excellence for 5 different areas, namely cancer, trauma, orthopedic, acute coronary syndrome, stroke, and then later on we implement for pregnancy, newborn, dental, and occupational health. So those areas are areas that we focus to drive towards Center of Excellence. And from that, we develop registries. So I can say that we may be the one and only private sector enterprise that implement a registry this March. And then we start collecting data from over the past 5 years. And within that, we monitor the process indicator and outcome indicator. And then once when we decided that we're gonna go for ICHOM, we start integrated patient report outcome measure into our registry. And that's how we integrate the idea of value-based healthcare into our clinic care. But not only that, we also try to reduce waste in our operation, not just only about cutting the cost, but to make sure that we actually doing something that most valuable for our clients. For example, in the past, we implement a stroke registry, and then we using CT scan for patients who come with the symptoms of stroke. But then we think about, we have MRI and we can actually offer the better investigation just in case. So now we have the stroke pathway that we can either use CT or either use MRI, just in case that the CT brain is not available because of congestion, or the patient may get a better benefit from doing MRI right away, not repeating CT and then MRI. And that's how we actually look into the value for our care. That's a great question to ask. It's a little bit difficult when we really start the value-based healthcare, but once when we actually dive into the value-based healthcare principle, we know that we have to move from healthcare provider centeredness into the patient centeredness. So then we incorporate the idea. We actually have the team that we gather to shaping up the patient journey. We ask our staff who used to be the patient in our enterprise. We actually randomly interview patients. We got the testimonial. We ask them to provide us an input in order to design the program or design the indicator to help us understand how we can actually improve patient journey. Also, a few years ago, we actually invited someone who worked in patient advocate organization in Switzerland. I I don't want to name the organization because we didn't ask for consent to present in this webinar, but he actually has those provide us some education so we can actually reshape how to put our focus on patient centeredness.